How was the Clark level used to stage melanoma? Imagine trying to figure out how deep a fire has burned into a building. That's similar to what doctors did with melanoma using the Clark level system. It was a way to describe how the cancer had invaded the layers of the skin. The skin has different layers, starting with the outermost layer called the epidermis, then the dermis beneath it, and finally the tissue under the skin. The Clark level assigned a number from 1 to 5 based on how deep the melanoma had gone into these layers. At the first level, the melanoma was only in the outermost layer of the skin, called melanoma in situ. This means it was confined to the surface and hadn't invaded deeper tissues. The second level meant the cancer had reached the upper part of the dermis, known as the papillary dermis. The third level indicated the tumor had reached the junction between the upper and lower parts of the dermis. When the melanoma invaded into the deeper part of the dermis, it was classified as level 4. The fifth and most advanced level meant the cancer had gone beyond the skin into the tissue beneath, called subcutaneous tissue. This system was helpful because it gave doctors an idea of how aggressive the melanoma might be. The deeper the cancer went, the higher the Clark level, and generally, the worse the outlook. It was especially useful for thinner melanomas, where knowing how deep the tumor had penetrated could influence treatment decisions. For example, a melanoma confined to the surface might need less aggressive treatment than one that had invaded into the deeper layers. However, over time, medical experts found that the Clark level wasn't as precise as they needed. It relied on visual assessment and was somewhat subjective. That's why it has been mostly replaced by the Breslow thickness, which measures the exact depth of the tumor in millimeters. This measurement is more consistent and provides a clearer picture of the prognosis. Today, the American Joint Committee on Cancer mainly uses Breslow thickness, along with other factors like ulceration and lymph node involvement, to stage melanoma. Still, understanding the Clark level is important for historical context and for reading some pathology reports. It helped shape how doctors evaluate melanoma in the past and contributed to the development of more accurate staging systems. So, in essence, the Clark level was a way to describe how melanoma had penetrated the skin layers, guiding prognosis and treatment before more advanced methods took its place. Always remember, if you're concerned about skin changes or melanoma, consult a healthcare professional for personalized advice and proper diagnosis.